This is a presentation about fentanyl citrate, a potent narcotic analgesic. The information have been compiled by Captain Thorbjorn Pearson, Captain Gordon Falvey, and Captain John Moser. Name: Fentanyl. This is the generic formulation and the common name of the drug. The formulation concentration in the vial is 50 micrograms per ml. Sublimase. This is the trade name of fentanyl. The formulation and concentration of sublimase is also 50 micrograms per ml. Mechanisms of action. Fentanyl is a potent opioid analgesic, which is administered by the intravenous or intramuscular routes of injection. Activation of the mu-opioid receptor will inhibit adenylate cyclase, promote potassium efflux, and an overall reduction in calcium influx, which will result in hyperpolarization of the cell and hence a reduction in cell signaling and pain transmission. Fentanyl has a propensity to cause dose-dependent analgesia, ventilatory depression via the medullary respiratory center, sedation, and at high doses, unconsciousness. During open heart surgery and certain more complicated neurosurgical and orthopedic procedures where surgery is more prolonged, and in the opinion of the anesthesia provider, the stress response to surgery will be detrimental to the well-being of the patient, dosages of 20 to 50 micrograms per kilo of fentanyl with nitrous oxide and oxygen have been shown to attenuate the stress response. When dosages in this range have been used during surgery, post-operative ventilation and observation are essential due to the extended post-operative respiratory depression. The main objective of this technique will be to produce stress-free anesthesia. Tidal volume will increase, but minute volume will decrease as rate decreases. Fentanyl is hemodynamically stable and is an ideal opioid for patients with cardiac morbidities. Fentanyl will also produce a pinpoint pupillary response called meiosis through the action on the Ehringer-Westphal nucleus. This response will not diminish due to tolerance or chronic use. This will always serve as a good indicator of use and/or abuse. Fentanyl also appears to have less emetic activity than either morphine or meperidine. Histamine assays and skin wool testing in man indicate that clinically significant histamine release rarely occurs with fentanyl, even at dosages up to 50 micrograms per kilo. Fentanyl is lipophilic and binds readily to plasma proteins. The fact that this drug is extremely fat-soluble accounts for its rapid onset and relatively short duration. However, this does not hold true during infusions, as fentanyl will saturate the tissues and end up prolonging the overall duration of the drug. Fentanyl will cross the blood-brain barrier and placenta due to its lipophilicity. There is also an inherent risk for truncal rigidity, also called mahogany chest, at higher doses. The overall potency, quick onset, and relatively short duration of action makes fentanyl an excellent choice for pain relief during anesthesia. Next is a graphic representation of the action of fentanyl at the cellular level. Activation of the mu-opioid receptor will cause the subunits of the G-sub-I protein to both inhibit adenylate cyclase and cause an overall reduction in calcium influx due to the inactivation of the voltage-gated calcium channel as seen here. The activation of the G-sub-I protein will halt the second messenger pathway by preventing the conversion of ATP to cyclic AMP when the G-sub-S protein is activated as seen here. At this point, the second messenger pathway has been stopped. The activation of the mu-opioid receptor via the G sub I protein and related subunits is also responsible for activating the potassium channel, which in turn will promote potassium efflux and result in the hyperpolarization of the cell as seen here. The combination of the inhibition of adenyl cyclase, the blockade of the voltage-gated calcium channel, and activation of the potassium channel will result in the hyperpolarization of the cell and a reduction in cell signaling and overall pain transmission. Dosing. Fentanyl is approximately 100 times more potent than morphine. As used for pre-medication with surgery, the dose is usually 50 to 100 micrograms. Adjunct to general anesthesia depends upon the type of surgery and the length of surgery. As a low dose, we use 0.5 to 2 micrograms per kilo. As a moderate dose, we use 2 to 20 micrograms per kilo. And as for high doses, we can use between 20 to 50 micrograms per kilo. An example would be open heart surgery. For pain management, we use a bolus to start. That could be 1 to 2 micrograms per kilo or 25 to 100 microgram dose. As a continuous infusion after that, we use 1 to 2 micrograms per kilo per hour or 25 to 200 micrograms per hour. For intrathecal injection, a single dose, 2 to 25 micrograms per dose, will give you relief for up to 6 hours. Epidural injection, single dose of 25 to 100 micrograms, will give you relief for up to 8 hours. Onset. The onset of fentanyl is roughly 30 seconds, and this is mainly attributed to the lipophilicity of the drug. The peak. The peak of fentanyl is roughly 5 to 15 minutes, and the peak can also be attributed to the lipophilicity of the drug. Duration. The usual clinical duration of fentanyl is 30 to 60 minutes. Also, the T1/2 alpha is 1.7 to 13 minutes, and the T1/2 alpha is also called distribution half-life, which is short due to the lipophilicity of the drug. The T1/2 beta is 219 minutes, and the T1/2 beta is the elimination half-life, which is long due to the accumulation of the drug in the tissues. And this is the reason why fentanyl should not be used as a continuous infusion. Metabolism. Fentanyl undergoes first-pass metabolism in the liver. The powerful CYP3A4 enzymes are the main factors responsible for breaking down this drug. The metabolite norfentanyl created by the metabolism has slight inherent opioid activity. Anything that would interfere with the CYP3A4 enzymes would lead to an increase in the overall bioavailability of fentanyl in the blood. This would include liver failure and various drugs. Anesthetic indications. For short analgesic action during the anesthetic periods, pre-medication, induction and maintenance, and in the immediate postoperative period recovery room as the need arises. Also, for the use as a narcotic analgesic supplement in general or regional anesthesia, epidural and intrathecal, for administration as an anesthetic pre-medication, for the induction of anesthesia, and as an adjunct in the maintenance of general and regional anesthesia. Fentanyl is a fast-acting with a relative short duration and makes this a primary opioid-used anesthesia. Using fentanyl instead of morphine during spinal or epidural anesthesia will make a difference in respiratory monitoring post-operatively and early discharge of patient. The use of morphine instead of fentanyl in neuraxial injection will require overnight monitoring of patients' respiratory status. Fentanyl will usually give you an early respiratory depression, versus morphine will give you a late respiratory depression. And therefore, if morphine is given, there is a need to have the patient stay overnight just to make sure that there's no complications in regards to the patient's respiratory status. Anesthetic contraindications. Absolute. Patients with known intolerance and allergy to the drug. Relative contraindications will be liver impairment, renal impairment, biliary disease, and severe hypotension. Concerns. Continuous infusion of fentanyl can be a concern due to the prolonged context-sensitive half-life. This picture is a graphical representation of the context-sensitive half-lives of various opioids, including fentanyl. As we can see, there's a prolonged effect of fentanyl as the drug accumulates in the tissues. A better choice for continuous infusion due to this fact would be remifentanil or sufentanil. Summary. Fentanyl is a high potency, quick onset, and relative short duration of action. It is an excellent choice for pain relief during anesthesia. Also, a good choice for narcotic analgesic supplement in regional anesthesia, used as stress-free anesthesia during cardiac surgery and also as pain relief postoperatively. Here are two valuable links regarding fentanyl that I used putting this presentation together. And here are the references that I used for this presentation. Thank you very much for your time.